A warm welcome to this session. Topic of discussion for today's is Brexism. Generally, the topic denotes Brexism means night grinding. That is the commonest term, a colloquial term that has been used to define Brexism. Now, before going to this topic, now we should know the following criteria to define Brexism. Okay. The activities of the masticated system can be divided into two types. Functional. All of you know the functions of the oral cavity. The function of the oral cavity includes chewing, speaking, and swallowing. That is the prime function of your oral cavity. Now, the other, that is the non-functional or the parafunctional habit is grinding of the tooth. Okay. As I told you earlier, Bruxism, otherwise known as night grinding. Okay. The functions of the oral cavity. Okay. That is chewing, speaking, and swallowing. Okay. That forms the normal habit. That is a normal function an individual will perform. Okay. As far as the Bruxism is concerned, Bruxism is abnormal oral habit. Otherwise, it is an abnormality, parafunctional oral habit, which means clenching or grinding of the tooth. Now, before going to the abnormal oral habit, Bruxism, we should know about the activities of the masticated system first. The main muscles, okay, as you see in the diagram, okay, the main muscles of mastication, your temporalis, your masseter, and the lateral pterygoid. Okay, these three muscle groups forms the your majority of your masticatory power. Okay, your temporalis, masseter, and the lateral pterygoid. Okay, this forms the main chunk of your masticatory force. With the help of these three muscles only, you bring your jaw together, move your jaws laterally, and clenching of the tooth. Okay. Now, regarding this Bruxism, okay, otherwise known as night grinding, the grinding of the tooth doesn't occur when the patient clenches his mouth or when he opens the mouth. Slight relaxation of the clenched jaw allows grinding movements across the teeth as the jaw is moved slightly forward and slightly to the side. Okay, one thing you should keep in mind is regarding these three major muscles of mastication: temporalis, temporomandibular joint, lateral pterygoid, and the masseter. Okay, this forms the main masticatory force for the jaw movements. Okay, now the grinding of the tooth does not happen when the person clenches or opens his mouth. Only when there is slight relaxation of the clenched jaw allows grinding movements. Okay. And now the definition of the term bruxism. As I told you, it is an abnormal oral habit consisting of involuntary, rhythmic or non-functional grinding, clenching of tooth other than the chewing movements. A normal chewing movement won't affect your teeth structure. This abnormal clenching, grinding of the tooth may lead to occlusal wear or occlusal trauma. Continuous grinding or rubbing of teeth, where the force will be more than the normal occlusion chewing habit. Okay. When the normal threshold of force is exceeding, you can expect wear and tear of your dentition. That is the continuous rubbing or grinding of your teeth other than the normal chewing pattern will affect your tooth surface. End up with a worn out tooth surface with the main symptom of sensitivity to the patient. That is the clinical picture. What I'm telling is the clinical picture of a bruxism. First and foremost, symptom will be pain, that is jaw pain after getting from bed, and sensitivity. These two symptoms are most commonly associated with your bruxism. And this parafunctional habit may be due to muscle hyperactivity. As I said earlier, this bruxism is a parafunctional activity, can be due to muscular hyperactivity. And now you should be in a position to differentiate between a functional and a parafunctional activity. The functional activity is your normal chewing, swallowing. Okay, those things are your functional activity of the oral cavity. The parafunctional is quite different from the functional activity. Okay, the functional activity will have a well-controlled muscle activities that allows the masticatory system to perform necessary functions with a very minimal damage to the tooth structure. A very minimal damage to the tooth structure. That is the functional activity. Okay, the parafunctional activity will end up with worn out tooth surface. Okay, most commonly the untreated posteriors. Most commonly the untreated posteriors, where the masticatory force will be immense. Now, can be regarding the definition for bruxism, it is a forcible clenching or grinding of teeth. Okay, and in 1983, there is a clear distinction has been made between clenching and grinding. Clenching, okay, that is called as eccentric bruxism. Grinding is otherwise called as an eccentric bruxism. Now, the basic thing that should be kept in mind while evaluating a patient with an abnormal oral habit, that is bruxism or the night grinding, is you have to see, looking for the clinical picture of the dentition. Okay, that is, if the clenching is there, otherwise called as eccentric bruxism. That means the worn out faces will be there in the anterior part of your occlusion. The anterior part of your occlusion will be worn out more in the centric bruxism. And in the eccentric bruxism, you can expect worn out posterior tooth. Okay, that is the difference between the centric bruxism and the eccentric bruxism. Now, the first one, that is your centric bruxism. Clenching of the teeth is forceful closure of the opposing dentition in a static relationship of the mandible to the maxilla in either maximum intercuspation or a eccentric position. Now, when you see the diagram or the schematic expression, okay, you can very well see the forceful closure of the opposing dentition. That is the forceful closure. Excess masticatory force in place, getting the mandible and maxilla in full cuspation. In full cuspation, or in a eccentric position, or in a eccentric position. This is regarding your centric bruxism. As I told you earlier, it can be a centric bruxism or eccentric bruxism. Your centric bruxism will otherwise known as clenching. Okay, this is nothing but a forceful closure with heavy masticatory force of your maxilla and mandible with full intercuspal relationship. Now, the next one, that is the eccentric bruxism. Okay, that is otherwise called as grinding. That is nothing but the forceful closure of the opposing dentition in a dynamic maxillomandibular relationship as the mandible arch moves through various excursive positions. Otherwise, lateral movements, lateral jaw movements. The eccentric bruxism will end up with the more, it will do more damage to the posterior tooth, where the posterior tooth will be in more forceful closure, a forceful worn out of the posterior tooth without the contact in the anterior occlusion, anterior teeth. So there will be more attrition in the posterior tooth. And the clinical pictures I'll show you in the later slides. This is regarding grinding. Now, this parafunctional activity, for example, appears to be controlled by an entirely different mechanism. Now, before learning about this abnormal muscular mechanism, you should know what is the normal muscular activity for clenching of your tooth. Okay, as I told you earlier, the pterygoid muscles, okay, the lateral pterygoid, the medial pterygoid, the masseter and the temporalis. These forms the main muscles of masticatory force for a functional activity. Okay, for a parafunctional activity, it appears to be controlled by a different mechanism. Not, can you see this? This closure of the mouth or the contact of the teeth is brought about by a different mechanism. When going to the reasons for this abnormal lower labit, okay, that doesn't seem to be any single factor that brings about bruxism. it is also rather evident there is no single treatment that is effective for eliminating or reducing all the bruxism. When the influence of the malocclusion becomes greater, then the patient's physiological tolerance and parafunctional activity is increased. If the resultant increase becomes greater than the structural tolerance of any structure, breakdown in that structure will occur. So it means, so as to put in a short form, okay, this bruxism is controlled by a different mechanism. That difference mechanism is nothing but there is no single factor to eventually pinpoint that is responsible for this bruxism. Okay, even there is no single point treatment option for eliminating or reducing the bruxism. When the influence of the malocclusion becomes greater than the patient's physiological tolerance, the parafunctional activity is increased. That is one thing you should keep in mind. Now, regarding the chief complaints of the patient. Patient may complain of muscle tightness or fatigue upon waking. Early morning wake up, he may encounter stiffness or difficulty in mouth opening, hypersensitivity of the teeth, and for some patients, they'll end up with severe headache. These three are the chief symptoms or the chief complaints of the patient. The pain in the teeth or sensitivity to heat and cold, chronic muscular facial pain with tension headaches, that is due to the severe muscle contraction, increased muscle tone, uncontrolled resistance to manipulation of the mandible. Now, regarding the symptoms, okay, you can expect pain, tenderness in the temporomandibular region also. Not necessarily patient will have sensitivity. Okay, since this is a chronic problem, not all patients will submit to you with a severe sensitivity. Now we have to look in for the other symptoms. The other symptoms are difficulty in mouth opening or tenderness, pain in the temporomandibular joint, and fatigueness in opening the mouth. These are the commonest. And what has been said earlier is the extraoral examination. Okay, extraorally, when you palpate the temporomandibular region, patient will have pain, tenderness bilaterally in the temporomandibular region. That is one point regarding to extraoral examination of this patient. The intraoral examination of the patient, you can very well check in for the occlusal wear. Okay, and it is like explained earlier, the eccentric bruxism, you can expect worn out tooth, occlusal wear in the lower anterior teeth, lower incisor, more commonly the lower incisors. The eccentric bruxism ends up with attrition in the posterior teeth. The antagonistic pair of faces can be matched, wherein you can look in for the how the direction of the grinding has happened. Since the enamel is worn out, the dentin exposure will be more, ending up in severe sensitivity normally, and if it will be increased while consuming any hot or cold stuff. Okay, these are all common symptoms that is associated with night grinding. And the other clinical picture is your flattening of your cusp tips, more evidently seen in the posterior tooth, the two from the premolars to your molars. And the worn out faces can be very well diagnosed by asking the patient to clench his teeth, wherein the worn out segments, the upper and the lower tooth, that will coincide very naturally. With that, we can assume the direction of your grinding. Okay. And the next one is why there is more wear in the anterior tooth. As said earlier, that is in the eccentric bruxism, you can expect your anterior tooth wear more. That is in the lower anteriors, lower incisors. There will be too excessive wear and tear. The mechanism of excessive wear associated with bruxism is based on the loosening and crushing of the enamel prisms between contacting enamel surfaces, which provides the grit necessary for rapid wear of the enamel. And when you see this picture very well, you can see the condition of your lower incisal tip, where the enamel is totally worn out with the dentin exposure. Here you can expect a very, very severe sensitivity with the patient. That is in the eccentric bruxism. That is in relation to your eccentric bruxism. You can expect more wear and tear in the lower anteriors. Now, the other clinical feature is the two patients having with the eccentric bruxism. You can look in for any previous restorations. What are the position of the previous restorations? And more commonly, you can expect fracture filling. Fracture filling in the posterior tooth, and mostly in the lower molars, where the masticatory force is more. When the patient is thrusting the mandible and maxilla with more excessive muscle force, that in the lateral movements, that is in the eccentric bruxism, you can expect a fracture filling, that too most commonly in the lower molars. Okay. And the this picture that is the previous one shows you about the fracture restorations, and this you can see how the tooth is fractured. Okay, the filling, everything is intact. Mostly the lower premolars, they'll be more prone for fracture in eccentric bruxism. In the eccentric bruxism, this is regarding to the fractured tooth, and this picture depicts your lower jaw with a fracture premolar. The filling, everything is intact. The mesial cuspal tip is fractured. And the other most commonest symptom is, while examining the tooth, you can expect increased mobility of the teeth. a grade 1 or grade 2 mobility, that too in the lower tooth. You can see tooth mobility especially very significant without any underlying periodontal issue. Okay, without any gingival disorder or a periodontal disorder, you can see a grade 1 mobile lower tooth, most commonly the premolars, if it is for a eccentric bruxism. Without any gingival or periodontal outcome, patient will have a tooth mobility. And same way, if in the eccentric bruxism, you can see for grade 1 mobility in the lower anteriors, the lower incisors. Okay, without any gingival issues or without any local factors, without calculus or without any gingival bleeding or any underlying periodontal issues, tooth will be mobile. That is one clinical feature with patient having bruxism. And the radiographic examination of a patient with bruxism. Okay, you can very well see the resorption of your alveolar bone. As you all know, the entire tooth structure, okay, is attached to the alveolar process of your maxilla and mandible. Your maxilla and mandible. So likewise, the patient is having any night grinding habit, you can expect resorption of your alveolar process. The resorption can be horizontal resorption of your alveolar bone. This OPG, the orthopantogramgram, clearly elicits the horizontal resorption of your alveolar bone, most commonly in the mandibular region. The alveolar process of your mandibular region with a resorbed bone. Now, the other clinical feature that you're supposed to elicit, okay, is the increased tonus or hypertrophy of your masticatory muscles. A patient with bruxism will often develop bilateral hypertrophy of the masticatory muscles, especially of the masseter muscles. Patient with bruxism often develop unilateral or bilateral hypertrophy of the masticatory muscles, especially the masseter muscles. Now, the next part is your examination of your temporomandibular joint. And any issues with the temporomandibular joint, okay, a joint pain, one thing has to be ruled out is, because the bruxism is considered as the one of the major factor in the etiology of TMJ disturbances. Okay, clicking, crepitus, locking of jaw, restriction of mandibular movements, or subluxation. These are the